EPAS1 mutations and paragangliomas in cyanotic congenital heart disease. Definition: pheochromocytomas and paragangliomas are catecholamine-secreting tumors of chromaffin cells with frequent germline, somatic, or pozygotic mutations in genes that are involved in epoxy-related pathways including VHL, SDHA, SDHB, SDHC, SDHD, SDHAF2, EGLN1, FH, MDH2, and EPAS1. Applications in medicine. These mutations result in aberrant and consecutive actions of hypoxia-inducing factors, HIFs, even under normal levels of oxygen, a condition known as pseudohypoxia. Beyond genetic causes, prolonged exposure to hypoxia has been reported as an environmental risk factor for pheochromocytomas and paragangliomas that arise in persons living at high altitude. Pros and cons. Given the relatively young age of patients presenting with cyanotic congenital heart disease and pheochromocytomas and paragangliomas, and rate susceptibility to pheochromocytomas and paragangliomas will be accepted to account for the most cases. However, no other germline pathogenic mutations or other syndromic tumors that have been associated with pheochromocytomas and paragangliomas were found in these 5 patients. issue applied to Ecuador. The high frequency of mutation of EPAS1 in the samples contrasts with rates of only 5 to 6% in cohorts of unselected patients with pheochromocytomas and paragangliomas, which argues for a causative role for the EPAS1 mutations in the development of pheochromocytomas and paragangliomas that arise in patients with cyanotic congenital heart disease. Conclusion: it is possible that EPAS1 mutations induce chromaffin cells that have been exposed to chronic hypoxia with the ability to amplify the oncogenic properties of HIF2 alpha.